Hey guys, Dr. Kirk here with Premier Chiropractic. So quick video today, just a little rehab tip. A lot of our patients will get this position as a stretch and then a subsequent exercise of either Pales rails or some sort of end range training. There's a couple different variations that you can use of this position, this 90-90 position, to train different ranges of motion in the hip. Okay, so if we're here and we're coming out over this front leg, this would be an external rotation stretch. And then we can modify that with the pelvis. We'll rotate into the backside hip for a little more of an internal rotation stretch. The purpose of this video is because sometimes we're working on hip mobility while someone has an issue in their low back. So with this position, you have to make sure that the low back stays in a good position if you're going to prevent the low back from getting subsequent pain from any of these exercises that we try to do, because lack of hip mobility can definitely lead to low back pain. But if we're doing this exercise wrong in the low back, it can also kind of flare up your low back pain. So it's a two-edged sword there. Okay, so the first thing we see with this exercise is kind of this lateral flexion of the trunk and the low back. So if you can think about that with your pelvis, if you're not in this straight line that we like, now people that are more bendy, you're going to be able to come up and you can probably hang out in this position. As you go into Pales rail, you can even take your hand off, okay? For most people, you need a little bit of support, and then as you lean forward, you're gonna get that stretch. If you're not activating through the core here, you're gonna get this kind of laterally shifted pelvis, and then lateral flexion of the rib cage as well, and then it puts your spine out of a nice neutral position. So we wanna make sure that we stay neutral during this stretch, okay? So that's the first thing we see. The second is if I went to the side, and this is probably the most common, is when we're doing this stretch, we really want the pelvis to be moving on the hip. Okay, so the hip right now is sitting like this, and then our pelvis sits on top of it right here. Okay, so now when we stretch, we're moving the pelvis on top of the femur. Okay, what we're not doing is we're not just bending the lumbar spine over top, because some people will say, well, I don't really feel a stretch, and they'll be kind of right down here. And that's a stretch, but it's not the stretch that we're after in this position. Okay, it's a different thing. All right, so if you're going to look at that, just look at my lumbar spine. If I were to do this incorrectly, I'm going to bend and come forward like that. That's not what we want. We want the spine to stay neutral as we bend forward, and our upper body and our torso is almost like a straight line, a straight like stick, and then I bend over top of that hip, and I get a much better stretch, and I'm at my end range here versus here, right? If I were to do that, I could get much, much farther, but it's not the point of the exercise. The other thing is if somebody has a lot of external rotation, you might need to put like a yoga block under this foot or something like that, just to make sure they can feel the stretch without getting out of that neutral position. So then the same goes for internal rotation. If I'm going to rotate here, we just want to make sure the pelvis is actually rotating on that hip and that we're not just twisting in our upper body only. Okay, so it's just a couple variations to make sure you stay pain-free with your hip mobility drills.